Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. And in this edition, we're going to talk about study habits and giving you some tips about how to study for either NCLEX or just your regular tests that you have in your classes. So this is not specific to a certain subject matter in terms of whether it be fundamentals or assessments or maternal or acute care or adult care. This is basically study tips that you can use throughout your rotations as well as preparing for the NCLEX. So if you want to see what I'm talking about, stay tuned. All right, and so we're back. So this video is a two-part video. The first part of the video is strictly me talking about tips that you all can use to help you study and be successful on your tests that you take within your courses as well as the NCLEX. So the second part of this video is where I'm going to actually take you to my computer and show you some resources that I have found to be helpful that you can go and practice study type questions related to your content. And then that way you will better be prepared to sit for the boards in addition to prepared to take your test, because oftentimes you are needing to know how to use application style questions. And that's how the NCLEX is preparing you for application style. So if you are not preparing yourself by doing these type questions, NCLEX style questions, which are application style questions, then you will not be successful and you're finding yourself kind of stumbling as to what is the instructor looking for, why is it I can't find the answer, things like that. So we're going to kind of dive right in. But before we do, I want to show you the shirt that I have on. It says nursing is my bae. I'm going to stand up so you can see it. And this shirt was sent to me by A Way with Words exclusive shop. It is an online nursing boutique, and she is a licensed practical nurse, and she's been a nurse for over 10 years. And she has her own online business as well. And so she's been doing that for 3 years. And the name of the boutique again is A Way with Words exclusive shop. And so I will have the information in the description box. She does not have a YouTube channel at this time, but she does have an IG page. And I will have that in the description box below so you can go to her page and purchase a shirt just like this one. So she actually sent me this shirt for me to try to see what I think about it. And this is, I love it. This is a size large, and I typically wear between a large and an extra large depending on the shirt itself. And so it's great quality. It has good stretch. I do like it. I definitely will be ordering more things from her, and I'm happy to, show her work or her products on my channel. So you also see me with this shirt on my IG page. And if you follow me on my IG page, which is Melanin MPN, Melanin RN _ MPN, you will see a picture of me in this shirt as well. And to get to my page, there is a direct link up there on the YouTube banner. One of them is my my plus size fitness, my makeup beauty page, and the other one is my nursing page. So if you're interested in either or, nursing is where you'll find this, and that is Instagram too. If you hover over it, you'll see where it says Instagram too, and that is this page, my nursing page. If you hover over the other one, that is my slay _ curves _ beauty page, which is my my fashion, makeup, beauty, things like that here. So feel free to go to either one of those and follow me over there. But again, I will have her information. Again, A Way with Words exclusive shop. This is Nursing is My bae, and I like it. It is on trend. It's cute. It fits very, very well. And again, I am pleased to definitely wear this for this video. All right, so let's go ahead and jump right in. So when it comes to study skills, this is what you need to be doing. Number one is always get organized. Oh, and I do have notes here. So if you see me look down from time to time, as per usual, it's because I have notes and I want to make sure I stay on track as well as give you complete, thorough information. So again, number one is get organized. So when it comes to studying, I find that a lot of students are not organized. They are just kind of everywhere. They don't have a system in place, basically. And so you need to have a system in place that's going to help you kind of guide you through what you need to be studying for. So Getting organized also means don't procrastinate. So if you have a test on Friday, you don't start studying Thursday, okay? The best thing to do is start to review your information or material within the same day that you had lecture on it, okay? So that's first and foremost. But prior to that, you should be also reading your material. So for instance, if you have lecture on Friday, today's Monday, if you lecture this Friday, you should have already read the chapters before going to class on that subject matter. So if the teacher says to read chapters 1 through 5 for the lecture on Friday, you should have read chapters 1 through 5, beginning at the first page of that chapter, ending at the last page of chapter 5, and that includes reading those little tables and boxes and things like that. Those are key places for instructors to get their information from that's on the test. So be mindful of that. They will definitely gravitate towards those boxes for key information. So definitely learn your little boxes, the tables and boxes and things and such. Learn them. They will help you not only understand the subject matter better, but also it's good testing material. So be mindful of that. Number 2 is once you get to class, you definitely need to, take notes when you are in class. So go ahead and take your notes. You should have already read the material, mind you. So that way, this allows you to really fully participate in the lecture and understand what he or she is saying. It allows you to also ask questions. The whole point of lecture is to fill in the gaps for you as to what you read prior to class. Again, prior to class. So be mindful of that as well. Class is to supplement your reading. It's to fill in the gaps for you with your reading. It's not to hear it for the first time. I guarantee you, if you read your lessons or your chapters ahead of time, thoroughly, and read for understanding, this is something I have to tell someone. Do not read just for the simple fact that I read the chapters. Read it for understanding and take your own notes while you're reading, okay? So I am going back. Read for understanding. If you are just reading to be reading, you have reading comprehension problems, such as myself. I have reading comprehension problems where I'll read and read and read, have no idea what I read. You have to read for understanding. If you do not read for understanding to the point where you could explain the material to a classmate or to a peer or to an instructor, then you do not know what you're reading. So read for understanding. Definitely understand what you're reading and read for the content, for the concept to be able to explain it to other people. So that's that. Also, again, like I just said, you want to have material to supplement in class, supplement what you have learned or what you have read in your book. Once you do that, oftentimes instructors will provide you a study guide. And a big no-no I find is that students will go and not read material at all, barely take notes in class, but get that study guide and just start answering the questions based off of what the study guide is prompting them to do. So before we even get into that, you're not learning this just to pass a test. It's not to pass a test and dump it. You're learning this to save someone's life. So don't think that the material that's on this study guide is all you need to know. Sometimes they pull things from out of the things that's not even a study guide. Mind you, those little boxes I was telling you about. But they have free reign to do that. Do not get caught up in a study guide in terms of this is what's going to be on the test for all instructors. Because some instructors will give you that study guide, but then still test you on something that was not on the study guide, and they have every right to do so because you are responsible for the whole chapters 1 through 5 or whatever your chapters were. So you are responsible for all the chapters that they tell you to read in advance. The study guide is supplemental material to help you, guide you in terms of where to focus your attention, but it does not necessarily mean it's what's going to be on the test. So understand that. You're using the study guide to basically test you to see if you know what the answer is. And if you don't know what the answer is, that's the content you go back and reread for understanding. It depends on how serious you are about this profession. If you're truly serious about being a lifesaver and helping someone, you have to do these steps. If you are just taking the test and hoping to get by, then it is what it is. But for the rest of you who truly want to be nurses, you have to know the material. So material for long-term learning and to save lives, not just for a test. So after you have been organized, after you have already read your chapter, after you have attended lecture and took notes, and after you have completed your study guide, and now it's time to review the material in which you did not know, like you thought you knew. You've reviewed your material. Then next is to actually do NCLEX style questions. So what do I mean by that? I tell students really from the beginning, you should be doing NCLEX style questions every single night. So whether that means you're doing 5 questions a night because you have a busy day for school or you have clinical the next day, or when you're on break, you're doing 10 to 15 questions per night. You need to do NCLEX style questions every single night for you to be successful with your test and as well as far as the NCLEX itself. I find that doing these kinds of questions really trains your brain into learning how to answer the questions. Be mindful of this. When it comes to the actual NCLEX itself, it is a standardized test that everyone takes. So if you're LPN, you take the practical nurse NCLEX. If you are in school for RN, you're going to take the RN NCLEX. So they're 2 different tests, but they're basically a standardized test that different writers have gotten together and say these are what we want to test on in terms of to make sure that you are minimally safe to function as a nurse, whatever level you are. So with that being said, do you think, for as an example, do you think that they are aware of what material you were or were not taught in nursing school? Do you think they're aware of what was or was not on your test? They're not. You're expected to know or to be able to kind of rule out certain answers to know this is not it. I know the concept of this disease process and this has nothing to do with it. Or what am I looking for when it comes to NCLEX style questions? So, or even questions on your test, which should mimic NCLEX style questions if it is a good test. So, with that being said, I want you to have a clear understanding that there's no way to prepare you for NCLEX in terms of every single subject matter. So it doesn't make a difference if you have or have not covered it in lecture or a class. The point of it is, that's why I say do these questions, the point of it is to simply have a way of knowing concepts, learning them, and then being able to rule out certain answers based on you knowing this has nothing to do with this concept. Or if they're saying that you have to have increased whatever, but it's actually decreased, well, you know that is not the answer. So therefore you can mark that one out. So that's kind of what this is about. So I wanted to kind of talk to you about those things. I do have another video in which I have talked about study tips. But this right here, I'm finding that people are not aware of truly how to study for tests and or NCLEX. So if you don't know how to study and you're making 50s and 60s and 70s on your test, hopefully some of these some of these tips will be useful for you. And you could implement this in your current practices and see if it helps raise your scores any. So just to recap before we go over to the computer so I can show you which 2 programs that I like to use to help students learn different things. And some of these you may already be using, but I want you to be using them in the correct manner as well. So recap, get organized. After that, you need to read the lecture material, meaning read the chapters ahead of time. And that's including your little table boxes, your figure boxes, your little boxes to the side, any of those diagrams, illustrations, things like that. Learn those. Those are good testing material. Then after that, you're going to want to go to class, take lecture notes, ask questions if you do not understand something. Again, lectures to fill in the gaps from what you read, not for you to hear the material for the first time. After that, you're going to use your study guide to go back again and retest yourself to see if you actually know the material. Any material that you did not know, you're going to go back to that subject matter, reread it for understanding, and then quiz yourself again. And then next is doing these NCLEX style questions every single night. And you should be doing, again, 5 questions, 10 questions a night, depending on what's going on with your schedule. If you can't do 5 tonight, do 10 tomorrow. If you can't, do whatever you can do. But you should be doing questions every single day until the day is time to take your NCLEX exam. So again, this is kind of a mirror between, you know, taking your test versus taking NCLEX. The concept applies both ways. Now, when it gets to truly taking NCLEX, the NCLEX itself, I have a separate video on that specifically. But if you're already taking or doing NCLEX style questions from day 1, or at least from the beginning of your 2nd year, NCLEX style questions every single day. If you're doing that, by the time you get to time to take the NCLEX and go take your subject matter such as your UWorlds, your Kaplan reviews, your Hearst reviews, your ATI, whatever programs you're using, you'll be well prepared for those because of the fact that you've been doing questions all along anyway. So that's just a tip for the NCLEX side. But what I'm talking about today applies to both NCLEX and as well as your actual study for your material every day. All right, so now we're going to switch over to the computer so I can show you exactly what I'm talking about in terms of where you can go if you do not have a book, like a NCLEX prep book, to help you with your questions. So I first recommend getting you a hard copy of a book. But if you don't have a hard copy of a book, or you just can't afford it right now, but you do have online access, I want to show you the internet versions of some of these things that will definitely help you. So I'll be right back. All right, so we are sitting at my computer right now, and I'm about to flip it over so you can see where I start when I'm wanting to look for ways in which I can get help with doing NCLEX style questions. So let's go ahead and flip you over. All right, so at this point you see my internet is up, and so now what I'm about to do is type in some things on the computer so you can see how to at least get started. So we're going to start with, let's say you're doing something on, let me think of something, stroke, okay? So maybe you're doing something on stroke. Or no, let's change it to OB, okay? Because that's my area, my subject matter. That's what I know. So let's change it to OB. So I'm going to type in here NCLEX questions on, let's say, well, let's just go with diabetes since that's the first one that jumped up. Okay, so let's go with that. Push enter. And then you see NCLEX nursing exam prep and things like that. So the one that I like to go to the most, so let me scroll down, see if I can find it. If not, you can always, here's one of them, which is Quizlet. So if you don't want to do it that way, you can go to Quizlet.com. And these are NCLEX style practice questions. So what I like about Quizlet, and I use this actually for a lot of different things for myself, even though I'm a doctoral student, they have flashcards such as these right here. So for instance, I'm going to zoom you in so you can see. So it says the nurse educating a pregnant client who has gestational diabetes, which of the following statements should the nurse make to the client? Select all that apply. And so you have your options down here. If you look at your scroll bar, you can see your options down here. And then down here, if you flip the card, it tells you exactly what your answers are. So the answers are A, B, C, and D in terms of select all to apply. And it tells you the rationale as to why it should or should not be. So that's just one example. So then to go to the next one, I simply just click on the little arrow here. And let's flip the card back over. Oh no, sorry. So it automatically goes back to the other side. So it says the goal for pre-prandial blood glucose for type 1 diabetic mellitus is. So what is our pre-prandial blood glucose level for this? And so anyway, here's your answers right here. What do you want your blood glucose to be? Pre-prandial. So you have to know what pre-prandial means, okay? And so then the answer to that, if you click on the card, it's less than 130. So you see how this works. So this is just like a little flashcard system, and these are NCLEX style questions. Here's another one right here. The guidelines for carbohydrate counting as a medical nutrition therapy for diabetes mellitus includes all the following except. And when it comes to, make sure you understand it says except. So you need to make sure you read your question very, very well. It says accept, and then after that, you're going to click on the card, and then the answer was B. So hopefully this is one website that I wanted to show you. Again, this is Quizlet.com. So you can see right there, Quizlet.com is a great website for you all to use when it comes to wanting to test yourself on the subject matter. So you can just simply type in Quizlet.com and then go to the search box, and you can put in NCLEX, or questions on diabetes, or just put, diabetes in there as it is up at the top left corner over there, and it will bring you up flashcards. And so, it gives you a test. So if you want to test yourself right here, if you want to just do, if you want to know how to spell right, it just has different ways you could do things. So here's the test mode. So basically it's going to, let me zoom you back out. So basically it's going to have 7 matching questions. So this is a great way to test your knowledge after you have studied the material. And so that way you can kind of see what you know. So if you're wanting extra help, start with this. So let's go on to the other site that I was telling you about. All right, so here's the other one I was telling you about. registerednursrn.com is another website that you can go to. So here's the website again, registerednursrn.com. And you'll know you're there when you see this purple. And this is a great tool as well to get your information in terms of learning how to answer questions. So this one, what I like about this one right here, it has an NCLEX review. So you can click on NCLEX review right here and it gives you exam questions. So for instance, if you want to, you know, depending on your system that you want to get into. So let's say, okay, maybe you want to do pharmacology because you want to learn more about your medications. So you click on your pharmacology right here. And so then it talks to you about your Coumadin and it gives you questions, is your review, and then you have your questions down here. So here's your quiz on specifically warfarin. So then if you, for instance, answer these questions, you know, and it gives you about, how many questions on this one? 14 questions. And then you click submit, and then it will tell you your grade at the end. It will say that you had a, you know, A, B, C, D, or F on at the end. And then it will tell you your rationale as to why the answers were right or wrong. So I love this because it tells you the rationale. And this is something that you could always do at home. You could do this when you are maybe sitting somewhere waiting on an appointment or whatever's going on where you have a few free minutes, because you can do this on your phone as well. They have this on your phone. So you need to be practicing these kinds of questions. And so this is a great tool to use. Again, registerednursrn.com and Quizlet.com are 2 resources that I like to use to help students learn how to master not only their school test, but master the actual NCLEX as well. All right, so we're back. So we are now at the conclusion of this video, but I wanted to definitely, hopefully, encourage you to definitely get on top of your studying and to make sure you have a clear understanding of what the subject matter is. And in addition to that, you need to definitely use these tools that I've told you about. This is not the only 2, but these are just the 2 that I definitely recommend because I have been using them with students and I have seen success when I mentor my students or tutor my students when it comes to their difficulties. A lot of the issues that they have with being successful on their regular test in class is the fact that they don't know how to study. So definitely utilize those tips that I provided earlier in the video to help you learn how to study so that you can master those tests. We need more educated nurses out there. And again, you're not taking the test. You're not remembering or learning this information just to take a test. You're doing this to save a life. I take nursing very seriously. This is like a passion of mine. This is my job. That's why I got this shirt. Nursing is my bae. I love nursing. I love being a nurse, a registered nurse. And I definitely encourage you all to work very hard so you all can become a nurse, no matter what level, just as I am. So if you are new to my channel, this is primarily a nursing channel. My name is Marita, and this is the Nurse Lounge. If you are here because you want to know more about nursing, you've definitely come to the right place. I am a registered nurse. I've been a nurse for over almost 15 years now, and I am a nurse educator. So I am sharing things with you, not from just this is how it is in the field, I'm just venting, in which I do have videos where I'm venting and things like that. But I am sharing things with you from a nurse educator, from an instructor's point of view, and how you should prepare for your test. Not for someone who, just because they passed med-surg or they passed whatever the class is and this is how they pass it, this makes it a tried and true method that this works for everybody. We all have different learning styles, and you kind of need to tap into your learning style. And once you figure out what your learning style is, it really helps you learn and really memorize the material that much better. So if you're here for nursing, welcome. I do have other material on my channel as well. So if you happen to like fashion, beauty, plus size fashion, beauty, I'm in school myself. So although I'm an instructor, I'm also in school myself. I'm on my doctoral journey. I'll be finished of May 2020, and I'm looking forward to that. And so I've also used some of these same forums in terms of Quizlet and Registered Nurse RN to help teach, for me to help teach, as well as for me to help learn about things like I needed an epidemiology that was really helpful for school. So I'm not only telling you these things to say this is what you should do. I'm actually using these websites myself for my own schooling, my own education, or my credentialing for my NRP or things like that. So anyway, thank you for stopping by the lounge. Until the next time, you all take care.